Great. So you may recall, and for those that are new in the room, the Canadian Collaborative is a partnership of 5 organizations: the University of British Columbia to the west of Canada, the University of Toronto, the Northern Ontario School of Medicine, Queen's University, and Emmanuel is here from Université Laval today. And when we were here in November, we had an amazing opportunity to talk a little bit about the setup phase of our project and some of our work around the start of the environmental scan. So I'm going to just touch on that work a bit and then tell you what we've been up to over the last 6 months. I think more importantly, we want to draw some of the results of our work over the last 6 months to the conversation we've been having over the last day around the social contract. So for those that are new to the room, really our work is focused on the notion of developing leaders to lead systems and enact socially accountable change with their communities. The anchor for our work remains, and I think the unique value continues to be how we think about social accountability and community engagement as we develop people and leaders across the system. And I really loved some of the discussion yesterday. There were a couple of quotes that came out of Matt's discussion and a piece that Sylvia and Dick led us through around the social contract. And they talked about really the social contract making explicit the purpose and meaning of our work, and that it's really about empowering people. Yesterday it was in reference to patients. In our context, it's about people and leaders, but it's about empowering people to influence change. And I think that is the root of our work around the development of a collaborative leadership program in the Canadian context. So when we were here in November, we had spent quite a few months actually setting up a very complex national project. And we were busy trying to secure some funding for this 3-year piece of work. And we're very proud to say, with a formal announcement coming soon, that we have garnered the support of the Ontario Ministry of Health and Long-Term Care with just over $2.7 million to fund the work over the next 2 to 3 years. So we're very, very blessed. We were in the midst of a review of a large-scale set of literature around curriculum and an inventory, and you'll hear a bit about that from Emmanuel. And we had just finished synthesizing about 250 articles that really mapped the leadership, collaboration, change, and complexity literature over the last 20 years. And we reported in November that collaborative leadership, while there's no one definition, and you heard that from our South African colleagues, the literature now is generally aimed at a broad movement away from the lone hero or the individual expert model of leadership to really drawing on multiple perspectives so that we can get richer responses to the complex questions that are facing us in our society. And I think this is another way to think about how this work is tied to the social contract. We also talked about the notion of leadership being drawn from any point in the system so that anyone can be a leader, whether it's small L or big L. And it was about tapping into the wisdom of organizations and therefore the innovation potential of large numbers of people. So since November, we've actually completed our environmental scan. The literature scoping review I just talked about was the first piece. The second part was actually conducting some international key informant interviews of about 35 people who are seen to be thought leaders in health professions education, in government, business, healthcare, and across our student body. And it's been interesting to note some of the themes that have come out of that there that are both synergistic with our literature review, but also very much aligned with the conversation that we've been having here. So again, the first theme that came out of the key informant interviews was this notion that there is no one definition of collaborative leadership and that it is very much context specific. And that was the discussion yesterday in the breakout group that I participated in around accountability and leadership, that how we draw on our various characteristics, attributes as human beings, and the kinds of actions we take are very much dependent on the context that we're in. The second theme was really around common characteristics of collaborative leaders. And here I'll link us back to the work that Sarita surfaced this morning, the Jim Cullen article that talked about character as probably the key piece to enabling the kinds of results that we want to see in terms of health system transformation. In our work, the notions of integrity, passionate purpose, and commitment surfaced in the data. But most striking was the notion of humility as a key characteristic of a collaborative leader. But beyond the characteristics, the third theme was really around a set of practices that collaborative leaders draw on that are different then how we think about traditional ways of teaching leadership in our current healthcare context. So the first one was around co-creating a shared vision with communities, as opposed to selling a vision that comes from a charismatic leader. The second practice was around using group process to draw on diverse and multiple perspectives, and to actually listen to those perspectives as formal leaders, to suspend our own assumptions and beliefs. The third one was around this notion of self as leader, self-awareness and self-reflection in an ongoing way as a leadership practice. And the fourth one was around influencing and engaging people, busting silos, the traditional silos that exist, and connecting silos that haven't been connected before. The fourth theme was from our key informants that there is an absolute need for a collaborative leadership program, as our traditional ways of developing leaders isn't really leading to the kind of sustainable and transformative change that we want to see, and that our approaches have been far too linear in terms of how we think about things like project management, planned change, and that very few, if any, programs are really very much rooted in social accountability and community engagement. And lastly, and I think this brings us back to the notion of the social contract as well, there was recognition, while there are some bright lights in our system of collaborative and examples of collaborative leaders, this is not the norm. That self-interest is too often rewarded and part of our culture, and that collaborative leadership as a philosophy and as an actual leadership program really offers the promise and opportunity to root our work in social accountability, and the idea that the social contract will always trump the notion of the lone hero. So I'm going to turn it to Emmanuel to talk a little bit about our program development.